Hi everyone. Thank you for joining us. We've got a few people sort of trickling in. Well, thank you so much for all the support. We've got a few emails, a few people interacting. So I just thought I'd quickly show you guys a little bit of collective minds radiology, what it is, because it can be a little bit like, oh, what does it actually mean? What does it do? So when you log into Collective Minds, what you end up seeing on the first page is the homepage, and you have loads of cases. You get hit with loads of cases, and these are cases involving neuro, MSK, vascular, chest. You can see it all. And it's quite interesting. You can kind of just go through the cases, have a look at the images, and see what interactions people are having with the cases themselves. So let's say, for example, you've got this one. You can click on it, and then it should eventually open up the actual case itself, and you'll be able to see some of the comments and things like that people, if they have replied and discussed it. And if you want to have a look at the images yourself, you can click on open review mode and have a look. Now, the point is to really teach and help one another, a bit of a global network. I think at the moment they're sitting about 9,000 people on this network. So lots of people from all over the world. I don't know if any of you guys managed to come see Collective Minds at UK.io, which was a conference at Liverpool, which happened on Monday, Tuesday, and today. They had a stand there. We had quite a few people showing interest to run their own teaching schemes, training schemes, courses, and that kind of thing as well. So yeah, do have a look. Getting an account is free, and at the very least, hopefully, you can all learn something from taking part in the community, and I'm there as well. And the great thing is that you can sort of at someone. So if you wanted to interact with me, you can just type in at Doc Lasker on the comments, and that just kind of alerts me by email saying that, oh, someone thought this could be an interesting case for you. And if you're anything like me, you quite like cases, you're quite looking at cases, you like getting a bit involved and having a bit of a conversation about what's going on and learning from one another. And it's really great because some people link in papers and things like that to do with the case that we're looking at. So it's kind of a nice sort of community teaching spirit that they've got going on. So anyway, today we are doing the third webinar where we'll just go through a few interesting cases. So far, I have very much concentrated on plain film x-rays, and I will start to do a few more different types of modalities as times go on. I keep it as chilled out and relaxed as possible. Oh, hi. Master, yeah, maybe. So basically I try and keep it chilled out, this is not a teaching session. If you want teaching sessions, I do run teaching sessions through other companies. Mainly radiology seminars is where I do a lot of my teaching, and we use this Collective Minds as a way to facilitate that. So we do run the sort of courses through this, but this is meant to be laid back. We just have a chat. I'm not going to say I always get it right. I don't always get it right, and I'm more than happy to take on people's feedback during, after, whenever, really. If you think that you don't agree with something I say, it's the main thing is to, so hopefully if you're a bit like me, a bit nerdy, and enjoy it. So I've uploaded a few cases. A few people like yourself in particular, who's in the chat right now, have thrown me a few cases to look at, and I've added that to this collection so that we can just kind of go through it and hopefully learn a few things. So what we'll do. If you want to say hi, please feel free to say hello in the chat, and while I decide to actually go through these cases. So I've made this collection over here, and what you can do is actually organize all your cases according to what you're up to. So on my particular area, because we run courses, we've got the sort of prostate course day, we've got the self-study day for one of the other courses they run, but for the monthly cases, I've made this. And it's quite good, it works perfectly, really, just like any other DICOM viewer. Obviously, depending on the screen, the resolution, that's kind of more on your side rather than our side, but the actual DICOM viewer is very, very capable, and you've got all the facilities there to be able to do the things that you need to. Right, so can I open the abdominal cases review? Just seeing, oh, really? Okay, not sure why. I'm gonna have to try and fix that later, because in truth, I was uploading it at the last minute again. There might be a situation where, what happens, sometimes there's a button that you press and it will say like make available for everyone. But so my apologies. What I'll do is I'll go back to it later, but if you don't mind just going through the cases with me live right now, and then just feel free to interact, comment, etc., and hopefully you still learn something. So this one hopefully is kind of straightforward. We've got a young patient come in with a bit of knee pain. How do I know it's young? what you've got to do is zoom in, and adult patients, they won't have these growth plates. And so what you can hopefully see here are a few growth plates sitting over here, going all the way along like so, another growth plate like there as well. And so this patient's got a few growth plates. They're fairly young. Not all, yeah, all the growth plates are visible, and they've got a bit of knee pain. And you can see that there is this region over here coming out, sort of a kind of quite well-defined protrusion coming out this way, like so, like so. Can everyone see that? And so when you see that,
I think someone in the chat was raising a hand. And obviously, if you've been to the previous webinars, I didn't do this in this introduction. But if you would like to talk, raise your hand, and I will unmute you. So if that was by mistake, you can take.
Okay, sure. So if you want to actually talk or get heard, then Saidul here will enable you to talk if you want to during this webinar, and just have a bit of interaction that way. Or just feel free to add questions and answers, or put your things in the chat and we can talk. So okay, hopefully you can see. Oh, we've got someone called Liz. Oh, Liz, can we let Liz talk?
Yeah. So just need to unmute if she wants to talk.
Okay, so Liz,
maybe it was by mistake. I don't know.
Okay, so I'm going to keep talking in the meantime, and you should be able to unmute. What I'm doing, click on ask to unmute. So we've got this quite a well-defined lesion that is sitting over here, right? So first of all, the thing is, some of you may know what it is, but it's really important to sort of go through basics. And basics means, is it aggressive or is it non-aggressive? That's all we've got to figure out. Aggressive versus non-aggressive, that's all. And so when you've got something that's well-defined, that literally you can see I've got the pencil right now and I'm drawing it very, very well-defined all the way around it, then you're probably thinking that it's going to be a non-aggressive lesion. Also, when you look at the cortex, the bony cortex, this is kind of the board of the bone. It looks very, very well-defined. Doesn't look fuzzy, doesn't look like it's irregular. So that's another good thing. And then you look at the surrounding soft tissue and try and see whether there's any evidence of any edema or any soft tissue swelling. And actually you can see that leg sort of just keeps going down like this. It doesn't have a sort of outbowing at any point. It doesn't do this around this area. So you're looking at what looks like a non-aggressive lesion. Now, there are a few characteristics appearance with this. So yeah, non-aggressive, benign looking lesion. Now, remember I'm pointing out the growth plates sitting over here. This is pointing away from the growth plate. And that's kind of one of the most pathognomic features of what this actually is. So this pointing away from the growth plate, not towards the growth plate, then what you're looking at is something called an exostosis. An exostosis is a bony protrusion. It can happen in very young patients, and they usually kind of stay the same, and they point away. They're very well defined, and they're benign lesions. Now, the thing about exostosis is that they also have what is known as a cartilaginous cap, a little kind of hat, like a little baseball cap sitting on top. And depending on you don't want to have it you don't want it to be a very thick cartilaginous cap. If it goes beyond about 1.5 centimeters, then you've got to start worrying that it start to transform and start to cause a few issues, as in sarcomatous transformation. Now, the thing is, I've unfortunately seen in some x-ray where people have said that there's no cartilaginous cap. And that's not actually something you can't say on an x-ray, because x-rays are only able to see calcifications and high density material. But you can't really see cartilage, right? Unless you've got calcification within the cartilage, you can't measure a cartilaginous cap. And the only way to really measure a cartilaginous cap is by doing an ultrasound or doing an MRI scan. So generally speaking, you don't really have to do too much with these exostoses because they're benign. Yeah, by definition, being benign, i.e. non-aggressive, you're looking at something that doesn't need to be taken out, doesn't need to have anything grossly done to it. But there is a caveat that if it starts to get more painful over time, then it may be transforming into something else, like a chondrosarcoma. Basically, it's starting to have a sarcomatous transformation. It starts to become a tumor. And the way you can know that is by doing measurements or regular follow-ups of this if it starts to cause pain. And an MRI scan is also very useful to try and measure the cartilaginous cap. And obviously, you've got previous imaging to try and help you identify whether this thing is actually growing, because if it's growing even bigger than it used to, then you have to be worried. Now, the thing is, like, sometimes these things cause pain, but it's not because it becomes sarcomatous. It's actually because the fact that it's got mass effect onto the surrounding structures. Now, you can imagine that someone like here, so for this particular patient, they've got this lesion over here. Sometimes you can actually, well, and this particular person over here, you can also see a bit of a protrusion over here. And you can imagine the surrounding structures, maybe the MCL, that can start to cause a few issues. You've got bones, you've got musculature that's kind of tugging away all over it. And so you can end up having quite a lot of inflammation, even though it's not sarcomatous. you can get inflammation of the surrounding tissues just based on the way the person is moving the leg and the surrounding musculature, tendons, and that kind of thing within the region. So there are sort of local mass effects that can cause problems. Now, if we go back to this particular image, and if we just reset all, you may have spotted actually that's not the only lesion that is sitting there. You've also got another lesion that is sitting over here. And again, it's pointing away from the growth plate over here, and maybe a little bit of a protrusion sitting over here, again, which would be pointing away from the growth plate over there. So there's actually a condition called multiple hereditary exostosis. And so that just means that the patient will have multiple exostosis all over the body, not always all over the body, but they've got multiple exostosis all over the place. And so they may end up getting a regular follow-up of these kind of lesions. So essentially this is what we're seeing is a single benign lesion, but actually it's not a single one. We've got 1, 2, possibly even 3, possibly even 4. We've got a few different lesions, which means that this patient's probably got a hereditary multiple exostosis. Essentially, yeah, exactly. Right.